Hey everyone, happy Wednesday. I'm so excited it's Wednesday. It's hump day. We're halfway through the week. We've almost made it through to the weekend. So, thanks for joining me tonight. If you are joining live, please comment live for me. If you're joining the replay, please comment replay. For those of you who don't know me, I'm Dr. Monica Tillett. I'm a doctor of physical therapy and the owner of New Direction Rehabilitation and Wellness here in Greensboro. And so tonight I'm going to be talking about total hip replacements and balance. So thanks, Mom, for joining. And anyone else who's joining on, if you could comment live or replay for me, that would be great. And thanks again for joining. So, have you had a total hip replacement? Hey, Stetson. Have you had a total hip replacement, or do you know someone who has had a total hip replacement? Okay, it's very common. We have a lot of people that go through those surgeries. Hey, Auntie, thanks for joining. And the reason that people have to go through total hip replacements is for a couple of reasons. One, they're having a degenerative process in that joint. So maybe some arthritis that's worsened over the years, and you have developed a lot of pain, with just simple activities of walking, and that's just more difficult because of the pain. Or it could be something traumatic like a fall or a car accident, or those with severe osteoporosis sometimes can just have pathological fractures and they need a hip replacement. So the hip replacements, are very necessary, and the doctors really only do them if it's necessary to do so. But most people that's had them done are glad that they have had them done because they can start to regain their mobility, and the pain is gone. It's just a rehabilitation process after that because it's such a major surgery. So there's a few types of hip replacements. One, you can have the surgery or the surgeon going through the front of the hip, which is going to be one of the better surgeries to have because you have a quicker healing time, and you have less restrictions. You hardly have any restrictions that you have to follow. And then you have the kind where the doctor would go directly in on the side of your hip to fix your hip, or go slightly behind your hip to fix it. And with those two surgeries, you have quite a few restrictions, and I'm going to go over a couple of those. And I just want to say that as a physical therapist, me or any other physical therapist cannot tell you when your restrictions are done. We cannot tell you what restrictions you have. That has to come from your surgeon, okay? So even me, being a doctor of physical therapy, I cannot overrule what the surgeon says you can and cannot do because he did the surgery. He knows the physical ability that you are in, and he's the one that's x-raying and making sure your bones are strong enough to progress you through certain things. We can take you through exercises under whatever he says, okay? So I just want to make that clear. So some of the restrictions that people are placed on with hip surgeries is that they can't bend over and get something off the floor. And it's because it's about that 90-degree angle in the hip, okay? So whether you're sitting down or standing up, if you've had the hip surgery from the side or the back, you can't bend down and pick something up off the floor. That could pop your hip out of place. And that sounds painful. You don't want that, okay? Another thing that you cannot do if you had those two surgeries is cross your legs. You cannot cross the midline of the body because that can cause your hip to pop out of place. And then the last one is you can kind of see, let me back up a little bit. See, my foot is pointed forward right now. You cannot turn that foot in because that rotates that hip inward too far. And so that can also cause your hip to pop out of place. So again, after the surgery, your doctor is going to tell you what you can and cannot do. And then also, he's going to tell you how long you have to follow those precautions. So it could be 3 months, 6 months, a year. It's going to be determined on your doctor. So you've gone through the rehabilitation process, okay? Because if you had just had a hip replacement, you're probably not going to be searching Facebook for different things to do, okay? This is going to be for people who's gone through the hospital rehab, who's gone through the rehabilitation inpatient rehab, and they've been home for a while, and they might be done with therapy and still trying to figure out what else can I do to get my walking better, to get my balance better, okay? So, a couple of things you're going to want to do. Let me close off this box because I can't see myself. All right, so it's all about putting equal weight on the operated side and the unoperated side, so the good side. So a good thing to start doing is just shifting back and forth. So again, this isn't anything major where it's bringing one leg too far in or too far out, but it's just getting you used to putting full weight on both legs, okay? So you're going to do it side to side. Then you're also going to switch after you get used to that. And you're going to do forward and backwards, okay? So when you shift forward, all the weight goes on the front leg. When you shift backward, all the weight goes on the back leg. So that's the first thing you're going to want to start with. The second thing is going to be really strengthening those hip muscles. The side muscles, depending on where the doctor went for the surgery, are going to be the weakest muscles, okay? So if they go in through the side or slightly back, then those muscles are going to be very, very weak, and those are some of the major muscles of balance and stability and standing. So you want to make sure those muscles are strong. If he goes in through the front, then it's going to be the front muscle, so you might have to work that a little bit harder. So what you're going to do is you're going to start with just kicking to the side, and if you want to make it harder, then add ankle weights. If you don't have ankle weights, then what you're going to do is a high number of repetitions. Or you can make sure that your foot doesn't touch the floor. That's tough, okay? Those of you going through my balance class, you already know how tough that is. So that's the side kick. You want to make sure you do those with a weight, or if you don't have a weight, high reps. The second one is going to be kicking back. We turn to the side. So you're going to kick back, same thing. You're going to keep your knee straight, but try not to touch your foot to the floor. And you can add an ankle weight. Okay, you're going to do that on both sides. And then the last hip exercise you're going to do is the hip flexion. And so just standing and just trying to keep that leg in the air, keep your feet off the floor, and just try to do those pulses. Try and bringing it up to, but not past, 90 degrees. So that's going to be hard to do in standing anyway. But just take it up as far as you can, but keep it 90 degrees or below. So, for those of you who don't know what that looks like, that's about 90 degrees in standing. Not many people are going to lift their leg that high. All right, so we've gotten the hip movements, we've gotten the weight shifting. Then you want to go into some marching, so alternating. But as you can see, my marches is nice and slow, so you have the time to fully shift the weight on each leg, okay? And to challenge that, if you have a little step stool, or if you have a, maybe you have a house with 2 floors and you have some steps in your house or steps outside, pick something that you can have a railing to hold on to, or something sturdy beside you like the kitchen counter. And if you need to balance yourself and hold on to that, you can. But I want you to try tapping. When you have something in front of you to tap, you visually have a target. So you have to raise your feet up high enough to get to the target. So I really love this exercise, okay? All right, 2 more things. Step ups. So once you've gotten the hang of this, you know, having that rail beside you or the kitchen counter, something sturdy, you can step up and down. And so if the left leg, you know, is the first one that you start with, then you're going to switch and lead with the right leg, okay? So essentially, you're going to be working both legs, the operated side and the non-operated side. You can't just focus on the operated side, okay? All right, so we're going to move this out the way. And the last and final thing we're going to talk about is the walking. So people with hip replacements oftentimes have that little short step. You might notice they're not fully, you know, taking big steps, just little shuffles. And that's because, could be 2 reasons. One, they're still not used to putting weight back on that leg. Or 2, you know, they just don't realize that they're doing it. They've gotten into that bad habit of walking from the pain prior to the surgery. Now the surgery is done, they're rehabilitated, and they have no idea that they still walk like that. So if you're walking like this, or you see someone walking like this, I want you to remember heel toe, okay? And I'm going to show you what I'm talking about. So you're going to put the heel out, you're going to roll forward onto the toes, and you see my back leg, my heel is up and my toes are still on the floor, okay? Bringing that leg through, back to the heel, back to the toes, heel, okay, toes. I want to show you what that looks like in a continuous pattern. Heel, toe, heel, toe, heel, toe, heel, toe. Turn, heel, toe, heel, toe, heel, toe, heel, toe. Okay? So I want you to practice that. It's going to feel weird. You're going to wonder or think that you look completely ridiculous, but it's only because you're trying to relearn a new habit. Keep doing it every time you're walking. Keep thinking about it, and you're going to realize that your pattern is getting more normal, and you're not going to have to think about it anymore. So if you have had a knee replacement, not a knee replacement, a hip replacement, or if you've had a knee replacement, and you're interested in getting more information on how to target a program specifically for you, then comment me in the comments and I can help you. I do have to let you know though, you have to live in North Carolina for me to give you direct advice, personalized treatment advice. But if you're, outside North Carolina and you feel like you need a therapist to take you through some more targeted things, then find a therapist in your state. But legally, I have to treat people who live in North Carolina. So if you're having problems with the hip replacement and your balance, comment me and I'll contact you, or you can call me at 336-283-5028. And again, have a great night, and thanks for joining me.